Thank you all for joining. Are there any topics in particular that people are interested in hearing about? This is a little bit of a comprehensive talk, and we sort of titled it Getting to Know Me. But ultimately, if there are like certain things that you'd like me to dial in on, that'll also help me sort of know where to concentrate my time. I think I had intended on talking a little bit more specifically about some face procedures, facelifts, blepharoplasties, but there's always a lot of interest in liposuction, body contouring, arm lifts, brachioplasties, and so we've got some stuff about that. And again, I can be a little bit more specific about things if you indicate through the message that you want me to talk about that. So, all right, well, let me get started here. I'm Dr. Kristopher Hamwi. Thank you all for coming. I would like this to be as interactive as you'd like it to be, so feel free to message us. I'm going to sort of start the talk by introducing myself and my team. This is sort of our primary clinical providers. I also have a nurse. I have two nurses that work with me and help facilitate our onboarding process and our consultations and then the recovery and that sort of thing. But myself, Kristen, our CRNA, who's also a nurse injector, and Sia, who's a physician's assistant, and my lead injector are our primary med spa injector team. Sarah is a licensed medical esthetician and helps with like skincare and esthetician services. And then I am the owner and the primary plastic surgeon here at the practice. So a little bit about myself. I did my training mostly on the East Coast. I was at Georgetown, I was in Boston at Mass General, and then I spent some time in the Midwest at Indiana University, and then ultimately finished up with a fellowship in Manhattan at New York Eye and Ear Infirmary. And so I have sort of a special interest in the face. I did special facelift training, but I'll tell you, I pretty early in my career got known for body contouring, and that sort of followed me throughout my practice. And a lot of the things that I do that people like search me out for are related to a way that I do liposuction, or the way that I incorporate liposuction into some of my other procedures. I am a board certified plastic surgeon, and I'm a member of the American Society of Plastic Surgeons and the American Society of Aesthetic Plastic Surgeons. My practice is in Sarasota, Florida. This is a picture of the building. It's nice. We've got some procedure rooms here, and so for my awake procedures, I do them here. We also have privileges at Lakewood Ranch Hospital, and I do most of my general anesthesia procedures and things that need a little bit more anesthetic, IV sedation, that sort of thing, at an outpatient surgery center in Lakewood Ranch. We have a med spa in the back, and so this is where they do a lot of like the skincare and injectables. And then for those of you who aren't from Sarasota, we're located in Lakewood Ranch, which is kind of like a suburb of Sarasota. It's really nice. The area that we're in is sort of in a newer development where they have been building shopping malls and hotels, and there's restaurants and things like that. So it makes it really convenient for people who fly in to find a hotel that's sort of near our office. And then, there's accommodations and things for, if you come with like your husband or wife, for them to do while you're sort of convalescing. We treat people from not only Sarasota, but pretty much all of over the United States. I think at this point, the last time we checked, we treated every state except for like the Dakotas and Vermont. So we're at like 47 of like the 50 states. And so if you are from out of town, we're, pretty used to helping and accommodating people who are coming in. I know that can sometimes add an extra layer of complexity, but we've got a team that's, really good at sort of helping you find your way, and will help you if you need help with hotels or, making arrangements in the area. Part of the reason that we attract people from other places is because we have some procedures that we do that are kind of unique and different than what are traditionally offered. And so one of them is sort of our awake procedures. We do some awake body contouring, and we're able to do certain procedures like arm lifts awake. And there was some interest in this to the point where they even made a little TV show in our office called Awake. It started one of my partners, but I was part of this, and it was sort of a fun seeing how reality TV is made. But that has really sort of caught on, and the interest in awake procedures has only grown, and our ability to do some sort of novel things because of the awake nature of the procedure, we're able to use some techniques that aren't really being used in other places. And I think it's giving us better results too. So just from a high level perspective, like why do we do what we do? Well, the reality is that people notice that over time things change. And ultimately, there's sort of this sense that we all kind of desire to look and feel our best. And so, if we can help people live their best life or get beyond something that's sort of been hanging them up, like that's really the driving force for us. And I tell people all the time that, the thing that gets me out of the bed every day, and the reason that I do this is I want to make people feel good. I want them, to overcome whatever challenge it is. And if I have something that can help you do that, I want to be able to offer it. At the end of the day, I sort of judge my success by your happiness, which is a high bar for a surgeon. But, I think that I want like all of my patients to really love, what we develop together. And I kind of see this as kind of a team thing. It's you and I want to get into your head and understand you and your goals in order to help get you to where you want to be. I like to talk about aesthetic treatments and what's out there on a spectrum, because aesthetic treatments and the things that I know and can offer are on a spectrum that ranges from less invasive things to more invasive things. And there's kind of a dogma that, as things become more invasive, they also become more powerful. But I think that the goal is to try and get people to wherever their desired outcome is with the least invasive treatment possible, with the fastest recovery, and in a way that with a risk profile that's comfortable to them. And so when someone comes in for a consultation, we'll discuss what their goals are and try and get into their head in regards to what they're trying to achieve, and then look at all the different things that are out there and talk about which one is maybe the best treatment option for them, and then get into the nitty-gritty about the recovery and what the process is like and that kind of thing. So if we look at the spectrum of treatments, we start with skincare. It's kind of the most basic and easiest, and no downtime. These are kind of the lotions and potions that you put on your body to keep things looking young, to prevent aging superficially. Injectables are kind of the next step up, and then energy devices, which come in the form of lasers, radio frequency devices, IPL or intense pulse light. These are all ultrasound. These are modalities that help tighten skin and tissue, and they start to actually manipulate the tissue themselves, but aren't quite surgery. And then as we move into the surgical procedures, you have awake procedures which use less anesthesia. And the idea there is that the less anesthesia we give you, the less medications we need to give you, the less your body needs to metabolize, sort of the faster you're back onto the next phase of recovery. And then we do definitely offer sort of traditional general anesthesia for some procedures. And so in some cases, this is the right option. So anyway, we'll kind of discuss that a little bit more as we move on. So I mentioned this before. I think when we're talking about the spectrum of treatments and trying to find the right option for people, there is kind of a sense that like the more invasive options tend to produce more dramatic results. So you can't expect a laser to necessarily give you the same result as a facelift. But not everybody needs a facelift. And so we try and, our goal is to, achieve the desired results with the least invasive option. But we also want to pick the option that gets the results that the patient's looking for. I'm going to talk a little bit about each of those individual sort of segments of what plastic surgery and aesthetics have to offer, starting with sort of the non-invasive things, the energy devices, then ultimately the surgery. Someone asked if we can talk a little bit about experiences with corrections and, if a surgery is done elsewhere, if there are things that can, another surgeon could potentially do to help address maybe a surgical mishap. Absolutely. Maybe we'll talk a little bit of that when we get into the surgical portion. So non-invasive things, just at the most superficial level, skincare. Skincare, I typically say like skincare is super important because you're trying to prevent aging. They talk about skin aging. 70% of skin aging is due to UV. Like that's crazy. So finding a good skincare, a lot of times you'll hear plastic surgeons and people who are aesthetically minded talk about how that's kind of like the fundamental aspect of aesthetics and of like a good skin health. I don't want to harp on that too much because I think most people are kind of here to hear more about like the surgical stuff. But we have some really good skincare lines. We spent a lot of time trying to find like the products that we felt were the best and things that like we would use. And I'll tell you, my wife loves these products. My team, my estheticians have said that like, this is the stuff that they want on themselves. So like that's sort of how we judge like what we want to keep in our office. And so if you're interested in skincare and you're local, you can come in and we can give you like a free consultation where we'll do a skin evaluation and help you find a good routine that is manageable and that you'll do. Because honestly, they talk about how the best skincare routine is the one that you do. Skincare can be used to help reduce, not only make skin look young and youthful, but also it can affect discoloration. Diamond Glow facials are another offering that we have. This is more of like a skin resurfacing treatment. They use a diamond-tipped applicator to essentially kind of resurface or remove that top layer of skin that can sometimes look dull or flaky. And there are medicated serums that are used that are also sort of infused into the tissue as you do this. It's really for like skin hydration and plumping, and it can give the skin like a really nice kind of glow and make it look young and refreshed. And so it's nice for people who have like events coming up or are trying to look their best for a certain thing. This is my wife. She loves these. In fact, we were just sitting in the car the other day, she's driving home, and she's like, why don't I do more facials? She's like, I should be doing this every month. And so anyway, it is. And it's nice because it's also, she was talking about how it's sort of like her me time, which we all kind of need sometimes. Microneedling is another, I think we kind of call it like a minimally invasive treatment. And I think that sometimes it doesn't get enough attention because the great thing about microneedling is it's this little pen that has little pins on it. We numb your face, you don't feel it, but the pins go in and they stimulate collagen and elastin growth. And it's a super low downtime procedure with like, minimal risks and minimal downtime. We talk about how like the more invasive something is, the more downtime you need. Well, this isn't particularly invasive and has some really great results. Now you typically do need a few treatments, so it's the sort of thing that like the more you do it, the more benefit you get from it. But it's also not like crazy expensive so that you can have multiple treatments and it's still less than a laser and you don't need to take the downtime associated with lasers. So quite honestly, this is one of those things that like, God, if I had more time, I would be in there getting done more frequently. Microneedling can also be used for like acne scarring and pitting. And so like, even if you don't have acne scarring and pitting, like these are the sorts of things that we expect and that we like out of this treatment. So it can be really nice. And like I say, I think the estheticians understand its power. I think sometimes plastic surgeons like underestimate how the benefit of it. And sometimes we'll see patients be like, wow, you look amazing. Like, what are you here doing? And it's microneedling very frequently. Chemical peels are sort of interesting, and we don't hear a lot about them, but the idea is that it's a chemical that essentially destroys the top layer of skin so that new, fresh skin can heal in its place. And so anyone's had a chemical peel will know that, like, you know, you put you have the treatment, the top layer kind of falls off in sort of a crazy way where it can, like, look like you have a bad sunburn and then peel off, and then you have this like, really fresh baby skin that looks amazing underneath it. And you have to protect it at first because it is fresh and fragile, but it really is like pretty dramatic in what it can do in terms of like helping with not only the way the skin looks, but also getting rid of some fine lines. It's not great at getting really deep wrinkles, and sometimes that's where like resurfacing lasers can do a better job of that. But it also can be really powerful in helping with discoloration. This right here is Luz, who's our receptionist, our patient care coordinator, and she has a condition called melasma. And melasma is a pigment problem with the skin where you get this sort of like camouflage look, and it can be a real challenge. It tends to be hard to treat, and if you can't get it away, it tends to come back. And she's been suffering with this for years. And we were able to find her a special chemical peel called Cosmelon that specifically is for melasma patients and patients with discoloration that, you know, wiped out the melasma. The picture, right here, the second picture down is her, I think like 2 weeks or a month after the treatment. And then the picture at the very bottom is her at like 6 weeks, 2 months after the treatment. And you can see it's, you know, I mean, like she loves it. And yeah, this is super powerful. And, you know, after seeing her and seeing this kind of results and then seeing this in some of our other patients, we're like big proponents of this peel. It's interesting. It's sort of like a proprietary formulation. So they tell you kind of what's in it, but don't tell you the formulations. So it's a thing that you buy like off the shelf and you apply it. But it's one of a variety of chemical peels. And so chemical peels are typically tailored to your specific like skin issue. Now for like the non-surgical options, we were talking about like these are, you know, things that are what we call sort of like minimally invasive. They're the injectables, Botox, neuromodulators, Dysport, Xeomin, things that prevent wrinkles from developing. We've got fillers that can either add volume or be used to plump up areas where wrinkles have already developed. And then you've got energy devices in the form of radio frequency devices, ultrasounds, IPLs, and lasers, all that are sort of aimed at either tightening the skin or helping with discoloration. They typically, the energy is used to help, I guess, injure the skin in a way that encourages it to heal tighter, stronger, and better with more collagen and more elastin. We also have exosomes, weight loss. We're not a weight loss clinic per se, but we do have access to the GLP-1 agonists, and they've really kind of revolutionized weight management in a way that we, you know, couldn't, you know, not be a part of. And so we, in select situations, will help patients, you know, with that. And Sia, my PA, has been on it, loved it, used it. Luz has been on it. Some other of our staff, and they've had a tremendous success. So if that's something people are interested in, give us a call. We can, you know, tell you all about that. We also offer laser hair removal. Botox, I don't think anyone's not heard of this. Tiny little injections into the skin, partially paralyze muscles. And when you paralyze the muscle, it stops creating the wrinkles. And so wrinkles that form when you animate eventually become wrinkles that are there all the time. They're called static wrinkles. And so if you can prevent the wrinkles from developing, then you can prevent them from becoming deep-seated wrinkles that are always there. So we tend to think of Botox as not only treating the wrinkles you have, but they also treat the wrinkles that you haven't developed yet and prevent those wrinkles from eventually revealing themselves. Fillers can be used to fill areas that have either lost volume due to aging or to fill the dermis, which is the meaty part of the skin where a wrinkle shows itself. And so you can, eliminate wrinkles by plumping them up with filler. But I also like to think of filler as a substance that treats volume loss. As we age, we start to lose the volume in our face. It atrophies, it shrinks. And so that's why people sometimes as they get older, they start to look a little bit more like a skeleton. And we can use fillers in a way to help volumize people without making them look totally crazy. Sculptra is one of these fillers that's used more for volumizing the tissue. It's an injection you put, and it actually stimulates the body to make more of its own collagen. Sia, my PA, who does a lot of our injectables, loves this stuff, and so she's a big proponent and uses it for patients. We do urge patients to be cautious with Sculptra if they are considering a facelift at any point, because there's some thought that, like, particularly Sculptra can make the tissue a little bit denser, and it just makes my job a little bit trickier when if we get to a place where we're talking about doing a facelift. Does anyone have any questions so far? I'm sort of, I guess, trying to buzz through this so we can talk a little bit about the surgical stuff. Wonderful. All right. I'm not going to get too far into the weeds on like the energy devices, but we offer Morpheus 8. Morpheus 8 is a microneedling radio frequency device. Numb the skin, pins go into the tissue, energy is delivered that helps tighten the skin in a way that can help reduce wrinkles, can remove some of the elasticity issues that people have as skin ages. It's nice because it can be used in all skin types. So I had a patient today who was talking to me about, like, she was looking for a laser, an ablative laser treatment, but she was of Asian descent. People with darker skin tones sometimes can react poorly to lasers and that they can create some discolorations. Whereas with Morpheus 8, that's less likely to happen. Morpheus 8 is usually, you need a few treatments to get the same results as a laser. Because it itself is delivering less energy. That's sort of like the benefit of it, is less energy, less traumatic, but you need a few more treatments. So usually we say you need about 3 to 5 treatments for this to get the skin contraction that we're looking for. Weight loss, again, it's just like, I don't know, I've been amazed by it. So GLP-1 agonists are a group of medications that are delivered most effectively through a little shot, like insulin, like a diabetic would give themselves under the skin, that slows down how food passes through your intestines, and it changes the way that you metabolize calories to some extent. And so people are losing 30, 40, 50 pounds on those medications. And, that can be really life-changing for some people. And so while I'm a surgeon and I love to operate, I am, very willing and want people to find like the best treatment option for them. And if it's not surgery, maybe it's, weight loss. Like losing 40 pounds can be transformative, not just from like the way you look, but the way you feel. And so if that's going to get you to where you want to be, there are options, and we're here to like help you with that aspect as well. And we've got a lot of our staff who've used it before, so they know the ins and the outs, and can help you deal with some of the side effects. Nausea is common with these, but not absolute. And there are ways that medication can be delivered to sort of minimize that. So anyway, just sort of an interesting thing. All right, so now I'd like to get a little bit into like the surgical options. And so surgical options are for more advanced signs of aging. And so they do tend to be more invasive, it's surgery, but they also deliver more dramatic results. So there's only so much we can expect to get out of good skincare or a laser or Morpheus 8. And so those are great for people that, are looking for non-invasive options and minimal downtime. But if you're really looking for like substantial, dramatic changes in like skin laxity, surgical options are sort of the gold standard. So I'm going to kind of, talk about liposuction and awake liposuction because we've got these, we're talking about the awake procedures versus the general anesthesia procedures, and we'll kind of move in that direction. Awake liposuction is something I sort of am known for. It can be really dramatic in terms of sculpting, and I like to think of liposuction a little bit more like sculpting than just volume reduction. And I sort of transitioned most of my liposuction to doing that awake because it allows me to nitpick a little bit. It allows me to do what I'm doing now, which is stand a patient up and check my work. And this precision has allowed me to do some neat things in terms of like sculpting. And I've developed this technique that I call buttock sculpting, where, I don't know if you can see my cursor, but we can do some things to sort of bring out the contour of the buttocks and give a little bit more shape and dimension to it without having to do a BBL, like that fat transfer. I think plastic surgery as a whole, and perhaps like the society, the aesthetic is perhaps moving away from BBLs. Not that we don't like good butt shape, but can we achieve that kind of silhouette and the shape without fat grafting? And I think the answer is yes. And I think part of that comes from our ability to sculpt with liposuction. And so that's sort of where and why I use the technique that I use for liposuction. Liposuction can be cool. It can be used all over the body. We can use it for, chins or the submental area. This is another example of, on the right-hand side of how we can use it to sort of bring out the dimension of this patient's torso without putting fat in. Like, this isn't a fat grafting case. This is just a liposuction. But by shrinking the torso, it sort of changes the hip to waist ratio in a way that like makes things more aesthetic. We use it on male chests for gynecomastia. And I guess this is another example of how you can shrink someone's torso and then make the butt look rounder without putting fat in. Thanks. Facelifts and neck lifts are one of my favorite things to do. I think they can be super dramatic, and I think our face is one of the ways that we sort of present ourselves to the world. And so what we find as people age is that the skin starts to loosen, the tissue underneath the skin that sort of supports the framework of the facial structures starts to loosen, and that starts to sag. And what ends up happening as that happens is we'll get a nasolabial fold that will start to develop. Jowls along our jawline. Our jawline will become less defined. The tissue in the neck starts to sag. All these things are sort of demonstrated in this patient on the left. And then with a facelift, which is an incision that kind of goes around the ear like this, we're able to reverse the signs of aging. Now, everyone sort of assumes that a facelift is all about the skin, and I'll tell you, the skin's important, but a well-done facelift really relies on resetting and lifting the deeper structure called the SMAS. The SMAS is a connective tissue layer that envelops the fat and the muscle within the face, and by resuspending and lifting that, it resets the frame and it holds all of the sort of structural aspects of the face back up. And then we use the skin to just sort of re-drape over top of that. And then it shows that nice structure, the jawline, the nice necklines. through the skin. So a skin-only facelift is not nearly as long-lasting as when you sort of manipulate the deeper structure. And so that's an important component when you're doing a facelift. Now, facelifts can be tailored for whatever particular aspect a patient is looking for. And this incision that you see that kind of goes underneath the sideburns and in front of the ear and then behind it is changed depending on what part of the face we're trying to address. All right. So the mid face, which is kind of the corner of the eye, the corner of the mouth, that usually requires the incision that kind of goes by the sideburns and in front of the ear. If we're talking about the jawline, we need our incision to go more by the front of the ear and kind of behind it like this. And if we're talking about the neck, we need our incision to go a little bit back like this. Now, facelift incisions tend to heal really well, and I'll show you some pictures here in a little bit. But they're beautiful because where we put them on the face, they tend to be inconspicuous and hide in hairlines and things like that. This is an example of a patient who had a face and neck lift, and you'll notice that the cheek is raised, the jawline is more dynamic, the skin and the tissue in the neck now has created a nice angle. They call it a cervico-mental angle. It's like the neck comes up and the jawline comes back and it creates this nice little angle. And we do that with a neck lift and a little additional technique that we call a blepharoplasty, or some people will talk about it as like a deep plane neck. But this is why I love facelifts. We do them on men as well. They can have a great result. When we talk about facelifts, because it's your face, you usually need to take about a week or two. I usually recommend 2 weeks off of work, or say that it's usually 2 weeks before you're what we call socially presentable. And I was just going to run you through some slides of what a patient looks like through the different phases of healing. So this is a patient that we did a face and neck lift on. This picture on the left is her before. The patient on the right is her 6 week after. And so she ends up looking great and loving it and everything. But this is her 1 week after. And you'll notice that she looks swollen. She's got a little bit of a yellow hue to her. That's kind of like a bruise that is resolving. You'll notice that her neck actually looks yellow. Sometimes when you have a bruise, it spreads to tissue that we didn't operate on. This is a little bit more bruise than we typically see, but I just kind of like to show it so that people are kind of know what to expect, because this isn't abnormal. This is totally normal, and give me another week and she'll look like that. All right. One of the other things you'll notice is that first week after, you have a sort of a scabby incision that kind of runs by the ear. That's going to fall off when you're in the shower. We ask that you don't scrub it off, and you just kind of let it fall off on its own. But you'll also notice that she's got a little piece of tape underneath her chin because there's a little incision underneath there. And then 1 week later, here we are 2 weeks post-op, the scabby incision has started to improve. If you look closely, you kind of see it, but it still kind of looks like a fresh incision. The tape we've taken off underneath her chin, still a little red, still a little swollen along the jawline. We tend to find that people stay a little bit swollen along the jawline and underneath the chin a little bit longer. And in fact, that area can take a few months to fully resolve. It tends to stay swollen for 6 months. And not crazy swollen. You'll go live your life and you'll forget about it. But if you're really critical and you're looking at things when you come in, I'll notice that that's still swollen and needs some more time. This is 4 weeks. So 4 weeks, patients are looking good, feeling good. They're usually itching to get back to the gym. And I tell them, pump the brakes, hold on. It's usually 5 to 6 weeks before we say, go live your life. And when you get to 6 weeks, we say you can play golf, you can play tennis, you can jump out of an airplane, ride a horse. You can go live your life. That little bit of swelling that still exists under the chin will continue to resolve on its own. The incisions still can be a little conspicuous. Incisions tend to heal over months and years. Scars tend to remodel and lighten over months and years. So, scars in front of the ear tend to be hard to find. Ones behind the ear can be a little bit more visible. But, if you wear your hair down, no one's ever going to know. Blepharoplasty is a big, long doctor word for upper eyelid lift. We often do these with facelifts, and I just kind of included it because it's commonly done with facelifts, but they don't have to be. In fact, we do a lot of these in my office a week because it's a really easy procedure, especially the upper eyelid. This is like some of the thinnest skin in the body, and so with a little numbing shot, we can do a blepharoplasty in less than an hour. You kind of walk in, walk out. You need someone who can drive you home because your eyes will be a little puffy. But it's can be really powerful in terms of eye rejuvenation. And a lot of times patients, the first time they'll ever see a plastic surgeon is because of their eyes. It's one of the first places that we age. And as the eye skin becomes a little droopier, it tends to make people feel tired and look older. And so it's a little procedure that can go a long way. This is an example of a patient. She's a little bit younger and she does not have a lot of loose eyelid skin. Sometimes patients come in and the eyelid skin is down, it's actually touching the eyelashes. But the way the procedure is done is if you look at that middle photo, a little sort of banana-shaped piece of skin is excised and then it's stitched up in the office. There's a little stitch, you see the blue ends of it sticking out there. You go home with the little stitch kind of sticking out and that comes out 1 week later. We don't tie the stitch with knots because it lays down the flattest that way. And so we put a little piece of tape over the ends so it doesn't slide out. And then when you come in 1 week later, it literally just slides right out. It doesn't hurt at all. This procedure is done and tolerated really well as sort of like an awake outpatient procedure, or it can be done with a facelift. These are examples of patients that had upper blepharoplasties. So her eyelid skin has come down, it's kind of like touching her eyelashes, and she's lost the fold above her eye. And sometimes patients come in and they don't really know how to articulate what they're seeing, but they'll say something like, I don't have any room to put on eyeshadow anymore. And that's the thing that they realize. And so when you do this procedure, you can create some space for eyeshadow, but the thing you'll notice about her is her eyes look like they're more open, they're wider, they're more awake. And so another one of these procedures that I love. Here's sort of another example of how excess eyelid skin can kind of create a tired look, and then reversing that completely changes the look of the face. So, all right, a little bit of a segue. I'm going to talk about arm lifts. Is there anyone here who's specifically here because they want to hear about arm lifts? Do you want me to get into the nitty-gritty on these? This is one of those things that I do differently than just about everybody else in the country. There are probably 3 or 4 people that do arm lifts like this. But I believe that this is the way that eventually everybody's going to do arm lifts because it's really, I think, light years ahead of a traditional brachioplasty. Arm lipo, but not lift. Okay, so let's talk about arm lifts versus arm liposuction. So this is an important conversation because liposuction in its sort of essence is a deflating procedure. When you take out fat, you are deflating the skin. And liposuction will allow the skin to contract on itself, but you have to have good skin elasticity in order for the contraction to occur. And so if you do liposuction and you don't have good skin elasticity, you're going to precipitate or create loose hanging skin. And so if you are 20 to 35, you are usually pretty safe with liposuction unless we're talking about really large volumes. Because that's the other component, is if we're talking about taking out a lot of volume, we're asking the skin to do a lot of contraction. As opposed to if we're taking out a little volume, we're asking the skin to do a little, and so perhaps if you're 40 or even a little bit more, the skin might be able to pull that off, all right? But a little bit later, I've got a little video of a patient that we're doing a brachioplasty on, and as the first step, we did liposuction. And you'll notice that her skin is very loose after the liposuction. And again, if you're young and you've got like young, healthy, like tight skin, that will retract. But if the elasticity isn't great, then we may have like be creating a bigger problem. So when I evaluate a arm patient, we are looking for their age, weight changes, how much has the skin been stretched and contracted and then stretched and contracted over their life. How much volume do we need to remove in order to get like the shape and the size that we want? And that helps like lead us to the appropriate procedure. There are skin tightening modalities that are out there. Renuvion, Body Tight are the most common and perhaps the most effective, in my opinion, at creating skin contraction. And they're really good. They offer something that like, it's a tool that we didn't have a few years ago. And I've seen it do impressive things. But I don't typically, if it's somebody needs a brachioplasty, I don't know if I can rely on it. In fact, I can't rely on it to give me sort of brachioplasty results. So it's really more for patients who are sort of like right on the edge of like, you know, maybe they need a brachioplasty, maybe they don't. Or they're a little bit older and we just want the best possible results. We don't trust their skin. So what's different about the way that I do brachioplasties? Well, what I noticed after treating arms for a long time is, unless you are young and you've got, you know, these beautiful like tight arms and they're just a little bit too big, or you are looking more for just like sculpting, you just need a little bit of volume out so that you can like sculpt the arm, is that arm patients, a lot of times, I hear the same story over and over again. It's that like arms don't play by the same rules as the rest of the body. They tend to grow with like you as you gain weight, but they don't tend to shrink with you the same way. And so they call this lipodystrophy. It's this idea that like the arms are like, or a body part is out of proportion with like the rest of your body. And this seems to be really common in arms. And so after treating arms for a long time and realizing that arm liposuction can be great and really powerful and do some really cool things, it sort of left out a portion of the population who had too much skin also. And so the idea was, well, if we can incorporate some cool liposuction with a brachioplasty or an arm lift, then we can offer patients something that they, you know, aren't getting with sort of traditional brachioplasties. And so the idea there is that I think when plastic surgeons look and evaluate arms, they all focus on the obvious stuff, the part that hangs, the part that we need to remove. But I think what's missed in that is sometimes the part on the side of the arm that like makes the patient feel wider. A lot of times when people's arms are at their sides, they'll say, I feel like a linebacker, or I bulge here, and that bulge makes me seem wider or feel bigger. Yeah, my arm hangs, but I also have trouble getting it into a sleeve. And I have to buy a larger size shirt just to fit my arms. And so those patients, I need to help them with the volume part as well. And so we shrink the arm, and by shrinking the arm, we've also now created a need to address the skin. And I can do that at the same time as the shrinking. So we shrink the arm, we tighten the skin. So liposuction plus a brachioplasty. And I'm not talking about just like the little part that hangs. I'm talking about addressing the sides of the arm, the top of the arm, in a way that sort of treats the arm in totality. And like I said, like I think everyone's going to end up doing this. It's just the way to treat an arm. but we're just not there yet. And I think that with time, give it some years, like you're going to see this more and more because we're able to do this in, and this is just it's different than what, you traditionally can get with a brachioplasty. The other patient cohort that is looking for brachioplasties are people that are they've lost the skin elasticity. And so if you look at this patient on the right, she's got crepey skin in her arms. And there's no, Renuvion, Morpheus 8 body type that's going to get rid of that crepey appearance. So a brachioplasty pulls the skin, pulls it tight, and helps, get rid of that crepey appearance. So ultimately, there's a couple of brachioplasty patients. The person on the left over here, we've made our arms smaller, but we've also created some definition, which is kind of a cool thing when you're doing an arm lift. The patient on the right has more skin. It's kind of hanging. It's kind of crepey. But I want to demonstrate for people who don't know much about brachioplasties, the trade-off of the brachioplasty is this incision or the scar, because essentially a brachioplasty is a tummy tuck for the arm. It's a lift, but with a tummy tuck we can hide our incision or our scar like in our underwear line. For a brachioplasty, we put it on the inside of the arm, and so that's kind of the trade-off. And for some people, yeah, that's an easy trade-off. Yeah, I'll take that all the time over whatever I'm dealing with now, not being able to fit my arm into sleeves. But for other people, they're like, let me think about that. And so I encourage people to, when we have these conversations, it's a conversation. It's about starting a dialogue and putting some ideas in your head so that you can go and investigate things a little bit more. And I'm happy to have as many conversations as you want until you get to a place where you feel like you found the right treatment modality for you. Let's see. This is a little video of a patient that I performed a brachioplasty on 3-4 months ago. And let's take a little video because she was part of this brachioplasty group that they're really helpful, and I guess they're very supportive of each other. And this video kind of helps describe my procedure, my technique. And so the first thing that you'll notice is that she's awake, and she doesn't look like she's in any distress. And that's because we numbed her up really good with local anesthetic. You'll see she's got a little incision right at the bend in her arm. She's got another one down by her elbow here. She's got a little one in her armpit. These are little pokes that we make, but that we're able to pump in numbing medicine into the area. And then I'm just going to stop this here, reverse it just a little bit, because once we get the arm numbed up, well, then we can do liposuction. And so we've done liposuction on her right arm over here. And you'll notice that arm looks substantially smaller than the one on the other side. So this is that kind of sculpting component and that shrinking component that allows us to get a more shapely arm that matches, that fits, that doesn't have that lipodystrophy sort of morphology that I was talking about. The other thing that it allows me to do is you'll notice that the skin is looser. This is why we can't get away with just liposuction, because I can't leave that loose hanging skin there. But the liposuction loosens the skin in a way that allows me to actually remove more than I otherwise would be able to. So when I do my drawings before the procedure, I mark out this sort of banana-shaped excision pattern underneath the arm. And that's kind of the skin that I expect to remove. But after I've done the liposuction, I'm actually able to remove more skin than that. And this is where the being awake part is so powerful, because whatever I thought I can remove is off the table. Now I reevaluate you and I get a sense of, all right, what's the optimal amount of skin I can remove? So I'm just going to replay that one more time to do a lot of talking. And if I'm off topic, people who want me to continue to talk about brachioplasties? I'll do it. All right. So anyway, what I was describing was when you are doing a brachioplasty or lift of any kind, you don't want too much tension. Tension is one of the things that affects what a scar looks like. Scars don't like to be pulled apart, they like to be pushed together. So by removing the volume and allowing the skin to kind of come together, you take the tension off of it, it's going to produce scars. So now I'm going to the liposuction. And then what I do is I tailor tack the skin. So I haven't actually made any cuts here. I've used little clips to kind of clip the skin together and lift it so I can start seeing what the arm is going to look like. And this step allows me to make sure that the amount of skin that I'm removing isn't too tight, but also like I'm not leaving too much behind. It allows me to like say, I want a little bit more. And so we kind of clip the skin and position it until I get sort of the shape that I want. And then here she is with the procedures done. We kind of sewed her all up. You'll notice like she's smiling. This like isn't a big deal. Patients kind of walk in and walk out and not much happened. But then one of the steps I do to help with the healing is I put a special dressing over the incision called a pico. And I love these things. I use them on like anything I can put them on, I put them on because they make me look like a champion. This is a special, it's a really advanced dressing that vacuum seals the incision and increases the circulation and pulls the incision together just by the very fact that it's kind of sucking down on it at a very specific pressure. And that pressure or suction has been shown at a microscopic level to also like signal to the cells to heal. And so the Pico was originally developed for wound care in plastic surgery. And sorry about this. I was technical difficulties. Apologize. So it was originally developed for patients that had big, nasty, diabetic wounds that like wouldn't heal for any reason. And they found that when you put negative pressure on these, it stimulated the cells to heal, and it sort of drew the wound in. And the guys that invented it actually like won a Nobel Prize for it because it was like so influential in wound care and plastic surgery and just like healthcare in general. Well, they started putting these negative pressure dressings over incisions that they thought were going to have problems. Patients who had like irradiated tissue, like cancer, over knee joints that like moved, old people that like were going to have healing issues, malnourished people, expecting that they were going to have a wound that like fell apart, an incision that fell apart or had problems. And what they found was not only were the patients not having breakdown of the incisions, but they were having pretty incisions. So the cosmetic world got wind of this and started using it and developed a device for like cosmetic purposes. And so I put these over my brachioplasty incisions in order to get prettier incisions and also to reduce some of the like risks or complications, because brachioplasties and thigh lifts can be prone to having little openings and incisions. And the more you can do to prevent that, the like better I sleep at night. And so because a lot of my patients are coming from out of town and don't just live right next door, it's sort of like a belt and suspenders approach to like promoting healing that, like I say, I think is just like allows like for the best possible outcomes, not only from an aesthetic standpoint, but also from like a safety standpoint. And so this goes on, it stays on for a week. If you're from out of town, you peel it off and we can do like a phone call or a video call or something like that. In order to get off, it just peels off like a big Band-Aid. If you are local, we have you come back in and we'll do it for you. Sometimes we do it for 1 week, sometimes we do it for 2 weeks. And then after that, you put on steri strips, which are like medical masking tape. And then the healing process is 6 weeks. Not that it hurts for 6 weeks, but it just takes the body that long to kind of glue itself back together before we let you go live your life. Okay? I am going to kind of start wrapping it up there and sort of open this up for questions if people have. Ultimately, with any of these procedures, people ask, like, when's the right time to do it? Who's a good candidate? We typically want you to have a stable weight and close to your target weight. With any sort of like lift procedure, you don't want to pull something all tight to make it look all perfect and just the way you want it, and then lose 40 pounds. Because there can be a deflation effect when you lose weight. And so you don't want something that's all tight in the right size and shape to then like deflate and then not be exactly the way you want it. So we typically say, lose the weight, then have the procedure. Non-smokers, super important. So smoking, and it's actually not the smoke, it's the nicotine. So patches, gums, vaping, all that stuff is super important that you cut that out. It affects the blood vessels. It causes them to contract. Nicotine is almost like a medication. It's an active chemical that will cause little blood vessels to clamp down, and smokers tend to have issues with necrosis or like skin guys. So with the procedures we're talking about, like that's would obviously be a big problem. Being able to take appropriate time off. I think that the recovery has a lot to do with the final results, and getting pretty scars has to do with how we take care of them in the recovery period. So being able to take the time off and having a good support system during the recovery is an important component when thinking about like the surgery. So timing it, finding the right time in your life, finding a routine that's going to help you with the recovery. Certain procedures require help with garmenting. Or maybe you won't be able to do laundry for a week. So like, how are you going to, deal with that? And so these are all things that we want you to consider and that we want to bring to the front of your mind when we do a consultation. So with that, I want to thank you all for coming. And I want to offer a virtual in-person consultation for anyone that would like it. We'll make them complimentary. A virtual consultation is sometimes more convenient for people, especially if you live out of town. You send in photos. We will help assist you on like what poses we want. But we will then set up a time for a phone call where I can look at them with you and talk with you and understand what your goals are and give you my recommendations for the appropriate treatment or treatments. And then my office manager and patient care coordinator, Scarlett, can provide quotes and help you navigate the process of like actually getting here and setting it all up. I also have a clinical team of nurses, Denasia, Diana, both nurses who help facilitate the getting ready for surgery process, who can help you with the, what's the preoperative steps I need to take, the postoperative care, will help get, if we need to get you certain medications and that kind of thing, we help facilitate all of that. So, with that, thank you very much. You can contact us by calling, texting, email us at connect@floridaplasticsurgery. Our website is floridaplasticsurgery.com, all spelled out. We've got some more information there. We've got before and after photos. And again, I hope that will stimulate some ideas that would then, you may be interested in coming and following up with a consultation. I can tell you more about the world of plastic surgery. So are there any, feel free now to text in if you have any specific questions. Someone earlier had asked about chin liposuction. And it sounded like they were saying, revisions where a patient has platysmal muscles have become visible. Okay, so one of the things that sometimes happens after chin liposuction is if you, the muscle is called the platysma, this guy right here, if you don't have a lot of fat there, it can become more visible. And sometimes as the body is gluing itself back together, it can lay down scar tissue. I think that's what they're referring to. Depending on the age of the patient and what's going on, ultimately I'd ask you to send a photo. And then that way I can see exactly what's going on. But there can be treatment options where, if you remember the facelift part of this, where we talked about that platysmoplasty, where you make a little incision underneath here, you can kind of release the muscle, and you can put a little stitch in it. It acts a little bit like a hammock to kind of hold it up and recreate that cervico-mental angle, that angle where like the neck comes up and the jawline comes back. A isolated or just medial platysmoplasty, where you're just kind of dealing with this part right here, can be one effective way to deal with that. Did the person who was asking about arm liposuctions versus arm lifts get their questions answered? Oh, okay. Someone asked about scar care after liposuction. And actually, scar care after liposuction is very similar to scar care after any procedure. So whenever you make a poke in the skin that goes through the dermis, which is like the deeper layer of the skin, the body heals by putting itself back together with a scar. So you're always going to have a scar. Now, what that scar looks like depends on a variety of factors. I typically say there's kind of four main ones. One of them is your genetics. One of them is the area of the body that you're operating on. One of them is like the environment in which it heals. And one of them is like the surgeon and what they do to help it like heal as quickly as possible. So in terms of your genetics, there's not much you can do there. Northern Europeans, Irish, English, they tend to heal with white scars. Sometimes they can heal red initially, but then eventually kind of fade to white. The darker your skin tone, typically the darker the scar that's laid down. And sometimes the more scar that's laid down. So, like I say, there's not much you can do about your genetics, but sometimes you can use it to sort of predict what a scar is going to look like. Then there's the part of the body that you're operating on. Faces, eyelids, the scars there tend to be invisible. They heal really, really well. Breasts and tummies are kind of middle of the road. Arms and legs tend to heal worse or more poorly. And so that's why we put a lot of attention into like doing everything we possibly can to get a pretty scar. We talk about the surgeon and things that they do to like make a pretty scar. Well, the way I sew it together is important. And so I spend a lot of time and I sort of pride myself on how we put things back together. But then the environment in which it heals is another thing that we have control over. And so this is preventing scar shifting or movement or separation. Scars don't like to be pulled apart. If anything, they like to be pushed together. And so there are a variety of things that are out there to help prevent scars from being spread. Scar tape that's nice and wide can be laid over top of a scar to help prevent shifting and movement. And so that's a good treatment. There are little clips that can go on the skin. This is a little bit of a newer thing. It's called a Bridget. And what it does is kind of pulls the skin together to prevent the pulling apart. The Pico, or negative pressure dressings, suck on the incision and kind of pull it together in a way that prevents that pull. Also, the type of stitches that we put in can affect scar spread. Some stitches are designed to dissolve at 6 weeks. Some are designed to dissolve at 6 months. And so depending on the procedure that I'm performing, I may use a different suture. I tend, when I do my brachioplasties, I tend to put in a combination of sutures that dissolve at 6 weeks and ones that dissolve at 6 months. The idea there is that the longer you sort of support the incision, the less spread there is and the more time the arm has to sort of readjust and for the skin to sort of start to shift and accommodate its new size and shape. If we're talking about liposuction scars, there's like, that's more of a poke. And so afterwards, good scar care with like creams, lotions, silicone sheeting can help scars heal a little prettier and prevent the body from putting down too much scar tissue. If you do start to get a little bit of a raised scar, you can also do like steroid injections. The problem with steroid injections is they're unpredictable. And so surgeons have gotten in trouble, or patients have had issues where like you inject it with steroid and you either get discoloration or it like over shrinks the scar and you got like a little bit of depression. Lasers and microneedling can also be really effective for scars too. And one of the things that's currently changed in terms of our thinking about treating scars is that for aesthetic purposes, you can start scar treatments as early as 6 weeks after the procedure. And the most current thinking is that scars really benefit from earlier intervention. And so starting with a microneedling or laser treatment at 6 weeks sort of kicks off the healing in a way that like, the scar will remodel or become looser and softer and start to blend a little bit faster because of that treatment. What else? People are often interested in hearing about post-operative care, garmenting after treatments. Plastic surgeons will vary pretty significantly on like whether they like compression garments or not. The idea behind a compression garment, we use them for just about all of our liposuction, all of our tummy tucks, to some extent some of our breast procedures, and for our arm procedures. And the idea with all of these compression garments is that they're trying to prevent swelling and they're trying to help sort of or mobilize the swelling that you do develop. Sometimes they can also like guide the skin and the tissue in. And so if we are worried or a patient has a little bit of extra skin, compression can kind of tell the skin or help sort of like guide it to like help it shrink. So I personally like compression garments and I try to use them as much as I can. The issue with compression garments is that if they are too tight, they can cause problems. They can dig in and create lines and wrinkles. They can dig in and create blisters and wounds or scrapes. They can dig in or compress the tissue too much and prevent blood flow and create necrosis. So you want to be like a surgeon needs to be judicious about the use and stay on top of the patients to make sure that they understand how to use them and when to use them. Specifically with my arm garments, I have been more likely to discontinue them a little bit earlier in patients who find that they are digging in at the elbow. With an arm garment, it can sometimes create a crease where the arm bends, and wherever you get a crease, you get an indentation, and you tend to get swelling above and below that. We like whatever we do to look the way we want it to end up the whole way through the healing process. So if you have like an indentation or a funny crease or line, we want to massage that. We want to figure out why that's happening and intervene so that everything kind of gets back to the way we want it to look as fast as possible. The idea being that tissue is a little malleable in that post-operative period. And so I tell people there's nothing that you can do in like a day that's going to ruin anything, but you don't want something to look funny or have a weird crease or lump for weeks or the entire healing process. So if the garment is creating a problem, we may tell you to take it off. And if you go to other consultations and the surgeon says, oh no, I don't use garmenting, it doesn't mean they're crazy. It's just like a different philosophy. So let's see. How much time do you take off of work? This depends on the procedure. I think it also depends on like what kind of work you do. So If it's a, work from home at a desk type of thing, a lot of times the answer might be 1 week. If it's in the office and my face, and it was a face procedure and I, need to interact with, people and that sort of thing, it might be 2 weeks. If it's, listen, I work in a construction site, well, it might be a month. Again, it kind of depends on the procedure. It also sort of depends on, how you heal. Patients tend to sort of heal along a pretty consistent, time frame, but we check in with you at regular intervals, and we want you to feel like you can continually check in with us so that you're not doing this alone. And you will constantly have access to me and my team so that, if you have a question about, is this normal? Or, when can I shower? Whatever. We don't want you sitting around wondering the answer, reach out to us. I really enjoy that. I've got a great team. I feel like I've got, a wonderful, group of clinicians and people to support our patients. And, so, I want you to also, feel like they're a reference throughout the recovery also. All right. If anyone has any other questions, then I am going to leave it at that. I think we're also going to save this presentation. And so if anyone, if anyone has any more questions, please feel free to call us, or we'll get this presentation uploaded so that it can be referenced if there was something that kind of stood out that you want a little bit more context for. So, all right. Thanks a lot. Have a good day.